Hello everyone, welcome to our channel where we try to learn something new and interesting. Today we are going to see male scrotal ultrasound that include spermatic cord, epididymis and testis. Today in OPD, a 46-year-old patient, of course we are talking about male patient, he came to OPD with a complaint of pain in groin area since 12 days. On clinical examination, we see scrotal skin are warm, erythematous and mild swelling present. And on scrotal elevation, he gets relief in pain. Always remember, if you get the time, there is no harm to examine patient clinically because it will help us to reach close to the diagnosis more firmly. So, on the basis of patient symptom, we decide to do scrotal ultrasound. But before that, let's see anatomy of testis in an animated image. In this animated image, we see tunica albuginea closely covered testis. Several yellow colored coiled seminiform tubule we see here that unite and continue as a retrotestis. Retrotestis open into epididymis via efferent ductule. Epididymis further continue as a vas deferens. This vas deferens is one of the content of spermatic cord along with vessel and nerves. Now let's see ultrasound finding. Now after this animated image, as we see here, homogeneous mild to moderate echogenic oval shaped right testis we see that is surrounded by hypoechoic fluid around it. Adjacent to testis, we can see here there is a heterogeneous comma shaped mild bulky epididymis, and adjacent to the epididymis we can see this is a tubular thickened bulky spermatic cord with increased echogenicity and edema. On color Doppler, we see increased vascularity in spermatic cord and epididymis. But good thing this that testis not show increased vascularity in color Doppler. This is the hypoechoic fluid around the testis, and we can see there is septation around it. On color Doppler, we see here there is not much increase or increased vascularity in testis. So, and this is the epididymis. Now let's compare with its left testis. And we see that in left side testis, epididymis and spermatic cord show similar character, but in milder form than right-sided. That is increase in vascularity and edema in left side of spermatic cord and epididymis. We see here there is increased vascularity mild in epididymis and spermatic cord. Okay, so all above finding suggests here that this is the case of epididymitis and funiculitis, that is infection of epididymis and spermatic cord. Due to this infection, inflammation occur that causes pain and reactive hydrocele and scrotal wall edema. If proper action not taken, it can also lead to architis, that is infection of testis, and further worsen the condition with the abscess formation. Usually source of infection in these cases from bladder, prostate or urethra or any active intervention done such as catheterization. Treatment option we have proper antibiotic coverage and analgesic, give proper scrotal support and treatment of underlying cause according to etiology. So in nutshell, we see a case of epididymitis and funiculitis with reactive hydrocele and scrotal wall edema. Hydrocele we see here present on only right side. In ultrasound, we see increased vascularity and bulkiness of spermatic cord and epididymis with altered ecotexture of spermatic cord and epididymis. Clinically, we see that patient got relief on scrotal elevation, as we say earlier. This known as prehensign and cremastic reflex are also normal. With compared to the testicular torsion, where prehensign and cremastic reflex are absent. So, thank you for watching this video. Kindly subscribe, like, and comment on this video and share with others so we got motivated to make more good content. Thank you. Have a great learning.